know, Huples Cat. Just going to do a little bit of round of actually news that's not from my local area, because we don't really have much news other than the fact we've still crushed the curve, but we have started to reopen. But I want to give my American subs in particular a taste of what Canadian news is covering in terms of the pandemic in the United States of America. And also I want to talk about what's going on. There's a few what I would call fear porn merchants out there that have been there since the beginning, talking about a lot of different things that they know nothing about. This is definitely causing severe social insecurity. I said at the beginning of this that what this is going to see at the end of it is a strong right-wing surge in governments, which I'm not happy about, but that's what's going to happen. Anti-immigration across the world and a lot of other things are going to be coming in place, and you can see it, so let's look at it.
Abbiamo trovato fino ad ora 43 positivi, noi dobbiamo mantenere in isolamento rigoroso le 5 palazzine. Isolamento rigoroso significa che per 15 giorni non deve uscire, non deve entrare nessuno dalle palazzine. La nottata scorsa 4 o 5 se ne erano scappati e questo non deve succedere mai.
Quite the scene. One of the things you need to do as an individual, whether you live in an apartment or you live in a house or you're homeless, I don't know how you manage that, you need to get a good supply of food and essential stuff in-house, so if you are actually put into quarantine, you do not need to go out. Now they are obviously supplying those condominiums with a ton of food, and that's great. But if lockdowns become really long and multiple, and you're also faced with lots of violence on the streets from different political perspectives, you might not get as much food from the government as you might be hoping for, and nobody's really going to care. Once it gets above a certain number of deaths, people don't really care about you as an individual, so you owe it to yourself to care about yourself and your neighbours and friends and family. And this one's particularly interesting because Italy is highly politicized in a lot of ways that are different from the United States, but in other ways they're quite similar. They have a lot of immigration. The immigrants, generally speaking, have integrated well. Some of them have not. The Romans have been targeted for violence across Europe forever, so this is just an old wound coming up in a modern context. I just want to flip to the States' own news reporting. This is from Russia TV, of course. When cases rise and people start dying and ICUs start to fill up and collapse, as is happening in parts of the United States right now, today, the people in charge are going to use draconian measures to stop human-to-human spread. And that is what is now starting to happen in the United States. How far will that go? Will there be a counter-reaction? Will that lead to violence? Undecided. It of course should not lead to any violence at all. Anybody in their right mind will not go out in public anyway, no matter what the government says, without wearing a mask and washing their hands. And people in their right mind won't go out unless they really need to. And people at work are going to take precautions not to get too close to other people or to spread the disease to themselves or to others. That's what people in their right mind would do. In 1918, Spanish flu epidemic, this is exactly the same scenario. Vast numbers of people in various places politicized the pandemic and decided to react against mask laws and quarantine laws and shutdown laws. And it caused the areas that did ignore it officially massive numbers of deaths compared to the areas that actually did lock down and stayed locked down or went back into lockdown as fast as the cases started to rise. But from an individual point of view, remember, you've got a lag time of between a week and 8 weeks potentially, where you are out and about without your mask in public and nobody has it much in your area, and you are getting yourself infected with SARS-CoV-2 virus before you start to see symptoms of COVID-19. So absolutely wear masks in public and stop coming up with silly excuses. And if you are going to be in public, shave that beard off. Make sure that you have an N95 and it can fit. Now I know a lot of people no longer have N95s. You should have got enough and you should be reusing them. Right now I'm baking mine upstairs for reuse.
When we started this in March, The median age of people who tested positive was, I think, 65. As the testing ramped up, that went into the 50s, but it was pretty much in the 50s for most of the time, and then just recently has really plunged. So that last week, the median age was 35 years old.
It's Miami-Dade County. It's the highest infection rate. So that's the demographic of the people that are most sick. That's the bad news. Also, the number of cases, the number of hospitalizations continues to go up. Here's the thing. State and local officials are saying two factors. One, the reopening of businesses, reopening of the state. They expected an uptick.
What they didn't expect was a surge. What they're dealing with today is a surge.
I think Tuesday set a record, more than 5,400 new cases of COVID-19 statewide. So basically, when you're looking at the health metrics on the state's COVID-19, the handy COVID-19 tracker, you're seeing an upward trend across the board. That is a concern for local and state officials. So quickly, what's being done? Well, here in the city of Miami, the mayor of Miami, Francis Suarez, has now required all residents, everybody who's out, to wear a mask unless you're working out, unless you're running, unless you're biking. I have a mask. You know, I'm not trying to fool you. I'm not trying to look cool. I do have a mask.
For those people who have been attacking me for criticizing President Trump's phenomenally bad handling of this pandemic, I would like to point out to you that today, the state of Florida alone has had more of its citizens infected than the country of Canada has. The difference is lockdown, not just words, not selective lockdown for some people from some airlines. We did it, and we did it strong, and we're going to stay locked down internationally, specifically with the United States of America, for quite some time.
Spike in COVID-19 cases, in fact the highest since the pandemic began, to try and curb a resurgence in New York, where one of the worst outbreaks began in the states. The governor, Andrew Cuomo, is taking steps now to quarantine travelers from other hotspots elsewhere in the U.S.
You know, knowing that we did everything we possibly could to restore their okay, you're gonna make me cry now. I have a hard time talking.
Now that's in Texas, where close to 97% of the ICU beds are full, and the governor's just halted the state's phased reopening to try to allow hospitals to cope up. Now on Wednesday, the caseload in the U.S. jumped by more than 38,000 cases. Now 3 states reported record increases in the new cases on Wednesday. Now that includes Florida, Oklahoma, and South Carolina. Earlier in the week, 7 other states also had recorded highs, including Texas, California, Nevada, and Arizona. And in fact, just a few minutes ago, Todd, the state of Mississippi also recorded its highest number of cases as of today. Take a look at this. Now, the neighboring states of New Jersey and Connecticut have also signed onto this travel advisory. Right now, that means anyone coming in from Arizona, Arkansas, Florida, North and South Carolina, Texas, and Utah will have to do a full quarantine once they arrive. So not just medical professionals at all, even the premiers of provinces like Ontario and BC have been working along with the federal government, and out of the point of view that it's important for the border to remain closed right now, looking at the number of cases we are seeing in the United States.
So here we are on June 26. Various states again are trying to shut down and quarantine people coming from other states. You'll notice from the maps they don't actually align with where the outbreaks are exactly, so that's a big problem. If you're going to shut your borders or quarantine people that come in, do it for everybody from every state. Don't just do it for a few states that yesterday were hotspots, because you've missed out the states today that are hotspots. Plus, like I said, this disease takes an awful long time before you actually see the hotspots whilst it's infecting people. So that's a really important thing. Now, the other thing that's going on, of course, is that Canada is full of self-assurance and we're patting ourselves on the head. Absolutely wrong. Absolutely. We're still in the first wave. It has been crushed right across Canada by incredible efforts from public health. Well, a little bit from them. But a lot of Canadians took it very, very seriously. The anti-mask and the opening argument in Canada was very tiny, a very tiny number of people, and pretty much every single premier of every single province and territory agreed with the federal government to shut down, stay shut down, whilst there was a risk of infection and death to any Canadian. So that's what we're doing. But of course we're reopening and people feel good about it, and I see it at work. People are like relaxed. People are looking at me strange because I'm still wearing my N95, and I will still be wearing it. It's a really dangerous part of the pandemic. We've had it The initial phase is dangerous because nobody's taking precautions, so that's why you needed to in January, February, March and April. And now a lot of places have crushed the curve, it's gone away, everybody's out and about, going to the bars, having fun, going to the beach. And infecting each other. The disease has not gone away. It's been dormant because it wasn't able to transfer to open non-immune human hosts, and now we're all out and about again, it can again. And the confidence is expressed by the gentleman that's about to speak after me. I have no confidence in him, nor in his assurance that Canada will be just fine, and if we have a few spikes in cases we can deal with it. I don't agree. If we open up like Florida has done, Texas has done, and a few of the other United States, who are actually now shutting down again as rapidly as they can, we will also see a surge. Not a spike, not 20 more cases today, but 2,000, 20,000 more. This disease is an airborne droplet pandemic. It is very, very dangerous.
Curious what you think this means. You know, the biggest city in the country reopening as of today, Toronto into stage 2. You know, are you confident?
I'm very confident. I think we need to congratulate ourselves as Canadians for having followed the rules and produced. We did this all together. I think that going forward, we still need to be vigilant. All of the things that I mentioned still need to be in place, but we sense progress from sea to sea to sea.
And a different situation in other countries, including in the United States, where, as you know, they've got more than 120,000 cases or 120,000 deaths, rather, and more than 2 million cases. Your read on that? You know, you're not far away from Washington State. I mean, what do you think we're going to see with that border?
Well, the border is going to stay closed until the social contract in the United States changes. There is a tacit acceptance of now over 30,000 new cases per day, and the death rate's going up now, once again approaching 1,000 deaths per day. This is a decision that the United States have made. We have made a completely different decision, and until these are better aligned, the border must stay closed.
The border must stay closed. That's the attitude up here. It doesn't matter about the economy. It doesn't matter about how much debt we have. We're a very rich country. Not as rich per capita as the United States of America, but Canada's well rich enough. We will go into extraordinary debt and pay the price for decades or more to save Canadians from dying. And I think that's a key difference in politics over here. Whether they're left-wing or right-wing, the Canadian politicians agree on that as a fundamental principle with dealing with the pandemic. Careful, gentle reopening with rapid lockdown again if cases spike. I think America has done some great things with the pandemic in some places, and other places have just really allowed their own people to get infected and die. And that's an absolute tragedy. It wasn't required. But again, it's a repeat of 1918, 1919 Spanish flu. I'm just going to go and relax a bit with Kitty in the garden because it's a beautiful hot day, because climate change is continuing, and I'm very worried about the food supply. There will be a video tomorrow where I'm going to do the first ever international prepper research project with Brad from Full Spectrum Survival, where we're going to put on face masks and do separate videos and show our pulse oximeter to disprove the rumour that these occlude your breathing and limit oxygen. They don't. It isn't that you're suffering from when you're wearing a proper N95. I'm also going to show you how to actually put on a surgical mask, because people aren't putting them on right. They're not putting them on right at work. I'm sick of telling people because they're not listening to me. Anything that takes a little bit of effort, that makes you safer, most people don't do. You're a prepper. You take that little bit of effort and you make yourself and your family and your neighbours that much safer. That's all from me. Remember, in SHTF, tomorrow will always be worse than today, unless you prep. And in a pandemic, it's always going to be worse than today until such time as the first wave is complete. The first wave globally is not complete. It may be approaching its peak, I'm not sure. We've deflected the peak rise down so much with lockdowns across the world that there is a potential that the wave will continue upwards. I don't know. It's hard to know the future. What I do know is it's worth a few months to a year of inconvenience not to die. That's what I think. I know that people disagree. Toodles. This was a Bad Terrier 2020 production. Just wear a mask. Right, Becky?